Okay, great. Good morning. This public hearing is now called to order. Today is Thursday, May 23rd, 2024, and the time is 10:04. I am Lorraine Pioni, a Supervising Assistant General Counsel at the New York City Department of Health and Mental Hygiene. Also here today with me as panelist, I have Michelle Robinson, the Deputy Executive Director from the Food Safety and Community Sanitation. I also have with me Svetlana Berdniak, Assistant to the Secretary of the Department. I also have Joseph Russo, who's paralegal for the Office of General Counsel. From the Department's Chronic Disease Prevention, we have here Teresa Coneglaro, sorry, I apologize, who's Policy Analyst for Chronic Disease. We also have here Elizabeth Solomon, Executive Director, Nutrition Policy and Programs. We also have Andrea Sharkey, the Assistant Director of the Healthy Eating Unit. Kim Kessler, Assistant Commissioner for Chronic Disease Prevention, may be joining later, but we're going to proceed. The purpose of today's hearing is to elicit comments and information to assist the Commissioner in determining whether to add new Chapter 39, titled Added Sugar Warning, to Title 24 of the Rules of the City of New York, which will require food service establishments to warn consumers about menu items containing high amounts of added sugar. While the department invites comment regarding the entire proposal, the department is particularly seeking comments on the health outcomes included in the proposed warning statement, which is, quote, eating too many added sugars can contribute to type 2 diabetes and weight gain, end quote. A notice of intention to add this Chapter 39 was published in the City Record on Tuesday, April 23rd, 2024. Copy of the first page of the Notice of Intention will be provided to the court reporter to include in this record. Persons wishing to speak at this hearing were asked to pre-register. There will be a limit of 3 minutes to speak. We have 3 people registered to speak today. The first registered person is Dr. Diana Nara. The second is Professor Pascal Rumo. And then the third is Tiffany Lee. We will go first with Dr. Nara. So if we could please unmute Dr. Nara, and she can introduce herself and give her comment. Just want to make sure. I do see Dr. Diana Nara. If we could unmute her, it looks like she's still muted. Oh, great. I see that she's unmuted. Dr. Nara, if you'd like to speak.
Good morning. My name is Dr. Deanna Nara, and I am a Senior Policy Associate at Center for Science and the Public Interest. Thank you to the Health Department for holding this hearing and providing the opportunity to testify. Center for Science and the Public Interest is a nonprofit consumer education and advocacy organization that has worked since 1971 to improve the public's health through better nutrition and safer food. We testify today in strong support of the Health Department's proposed rulemaking regarding high sugar warnings on food service establishment menus. As the first city to mandate added sugar warnings on chain restaurant menus, New York City is leading the way by promoting transparency and helping consumers make informed dietary choices. New York consumers have a right to know about the safety risks associated with overconsumption of added sugars and deserve to have access to information at the point of service about foods and beverages that may harm their health. The proposed rulemaking represents a common sense approach that would provide vital, evidence-based information to consumers and improve the food environment with the long-term goal of reducing the risk of diet-related chronic disease. The proposed rule will significantly benefit public health. Unlike naturally occurring sugars found in fruits and vegetables, added sugars are concentrated sugars added to processed foods and drinks to make them more palatable, providing empty calories without the filling fiber or beneficial nutrients that come from whole, unprocessed foods. Overconsumption of foods and beverages high in added sugars is linked to an increased risk of chronic diseases like type 2 diabetes and cardiovascular disease, in part by increasing the risk of weight gain, and can also contribute to dental decay. Addressing such consumption is particularly critical in New York, where diet-related chronic diseases like type 2 diabetes and heart disease are the leading cause of death across all racial and ethnic groups. More than 1 in 3 third-grade students has untreated tooth decay, and 1 in 4 adults ages 65 and older has no teeth. Chain restaurants consistently normalize overconsumption and are responsible for much of the excessive added sugars in the food environment. Individual meals offered by chain restaurants regularly approach or exceed the dietary guidelines for Americans' recommended limit of added sugars that a person should consume in an entire day, making it nearly impossible to regularly consume these foods while also maintaining a healthy diet. Much of the added sugars in restaurant meals come from sugary drinks, and the most consumers who buy a sugary drink at a quick service chain restaurant get a beverage that contains enough drinkable calories to supply a full day's worth of added sugars. Additionally, consumers struggle to detect the amount of added sugars in restaurant menu items. The Sweet Truth Act helps close this information gap for New York consumers. This law improves the restaurant food environment by requiring warnings on menu items with more than a day's worth of added sugars, empowering consumers with information and encouraging restaurants to author healthy options. Evidence from randomized controlled trials and real-world studies suggests that nutrient warnings can increase consumers' knowledge of added sugars content and lead to lower added sugars purchases. Additionally, warning icons provide a pictorial element, making them accessible to low literacy and non-English speaking consumers, providing more equitable access to information. The proposed rule is both a valid exercise of the department's authority and is constitutional. The department has a legislative mandate to issue the proposed rule, and Local Law 150 directs the department to issue a rule designating a warning icon and a warning statement. Further, neither federal nor state law preempts the proposed warnings. The department's proposed rule could benefit from specific changes to make it more effective. The department should amend the proposed rule to modify the warning statement language. Although the current warning language is factual and therefore constitutional, there are specific changes that would make it more comprehensible and potentially less likely to promote weight stigma. To that end, we recommend modifying the current warning statement, eating too many added sugars can contribute to type 2 diabetes and weight gain, to high added sugars intake can increase risk of type 2 diabetes, weight gain, and tooth decay. Replacing eating too many with high intake would include both eating and drinking added sugars. The phrase high intake and increased risk would also align the added sugar warning statement with New York City's existing sodium warning statement, which states high sodium intake can increase blood pressure and risk of heart disease and stroke. Furthermore, there is strong evidence that high intake of added sugars can increase the risk of type 2 diabetes, weight gain, and tooth decay. Aside from being supported by science, adding tooth decay as an outcome may be more effective at reaching consumers with health concerns beyond type 2 diabetes and weight gain. The department should amend the proposed rule to require the warning statement to be posted on menus and at self-serving dispensing points. For example, self-service soda fountains, The proposed rule should cover an expanded number of locations on which the warning statement must appear. Local Law 150 requires that the factual warning statement be posted in 3 locations. 1, prominently and conspicuously at the point of purchase. 2, on the menu or menu board. And 3, at any location where a food item requiring an icon pursuant to this subdivision is sold as a self-service item dispensed directly to the consumer. However, the proposed rule is plainly inconsistent with the language passed by the council and incorporates only one of these locations, stating only the following statement must be posted prominently and conspicuously at the point of purchase of a covered establishment. The department should amend the proposed rule to issue guidance instructing restaurants on electronic menus and ordering. We urge the health department to issue guidance instructing restaurants on the use of the icon for ordering on electronic menus, including electronic menus in store, ordering through the restaurant's proprietary application, and ordering via a third-party application. The guidance should clarify that the warning must appear wherever the menu item appears on an electronic menu, even if that menu appears on multiple pages. The department should also simplify the process for restaurants to demonstrate the amount of added sugar in a menu item by posting such information as part of the nutrition information made available to consumers. The rule currently states that a food item that is identical to a prepackaged food item will be presumed to have the same density of added sugar as is displayed on the nutrition facts panel of the corresponding prepackaged food item unless the food service establishment demonstrates otherwise to the satisfaction of the department. We urge the department to clarify clarify that a restaurant can demonstrate an alternate added sugars content for its food items by publishing the amount of added sugar in nutrition information available to consumers. Such information should be adequate to demonstrate the added sugar content of a menu item to the satisfaction of the department, because both federal and state law require such consumer-facing labeling to be factual and non-misleading. Such an approach will simplify compliance with the rule and could potentially provide benefit of encouraging restaurants to post added sugar information in a manner that is accessible to consumers. The department should also amend the proposed rule to modify the warning icon design to ensure it is as effective as possible at helping consumers identify high added sugar items. To increase noticeability, we urge the department to require added sugar warnings that include icons and text. In a menu ordering task of a recent randomized controlled trial testing added sugar warning label designs, added sugar warning icons accompanied by, quote, sugar warning text led to 11 fewer grams of added sugar ordered compared to icon-only warnings. Another way to potentially increase noticeability of icon-only warnings could be to require the added sugar explanatory statement to show the icon accompanied by, quote, added sugar warning text. The department should also consider modifying the added sugar warning design to be read at 150% of the height of the menu item text and to be placed to the right of the menu item text. A recent randomized controlled trial testing added sugar warning label designs found that red added sugar warning labels sized at 150% of the height of the menu item were strikingly more noticeable than black warnings sized at 100%. Finally, the icon design should clearly indicate that a product is high in added sugars, especially if the icon is not accompanied by, quote, added sugar warning text. We recognize the value of creating a label that is distinct, but clearly related to the existing sodium warning label. One way to further distinguish the two labels can be illustrated by other countries and mimicking the design for added sugars, which shows the spoon at an angle to more clearly show that it contains sugar. In conclusion, CSPI strongly supports the proposed rulemaking and applauds the steps that New York City has taken to put progressive public health initiatives in place. We also encourage the department to ensure that the final regulations take the changes outlined into consideration to increase its public health impact. Thank you for the opportunity to comment on this important issue. We look forward to continuing to partner with you all and work towards our shared goal of reducing added sugars consumption, ensuring a safe food supply, and enabling consumers to access information they need to make healthy choices for themselves and their families. Thank you.
Thank you, Dr. Nara. And I don't think that we've received a written comment from you, but it would be very helpful if you could submit one shortly after the hearing. Okay. I do see that we have our second speaker here, Professor Pascal Rumo. If we could please unmute Mr. Rumo. Wonderful. I see that he's unmuted. If you'd like to introduce yourself and give your comment.
You can hear me, right?
Yes, I can hear you. Thank
Great.
you.
Yes, thank you for the opportunity to testify at today's hearing regarding the proposed rule for the Speech Truth Act. My name is Dr. Pasquale Rumo. I'm an associate professor in the Department of Population Health at NYU Grossman School of Medicine. I conduct scientific research that informs policies and public health programs seeking to improve healthy food choices and prevent nutrition-related diseases. One of my areas of focus is indeed nutrition labeling and its impact on food purchasing behaviors. And so while I support the proposed rule, I would like to present some research that supports several key changes to the amendment that I would like to recommend to improve the effectiveness of the proposed rule. So I do have a written statement that's a little bit longer than this, but I cut it down here for the speaking part that I can share shortly after this meeting. So first, I propose that DOHMH should amend the proposed warning statement language. So the current warning statement is narrow in scope, and that's because there's compelling scientific evidence that high intake of added sugars can increase risk of not only type 2 diabetes and weight gain, but also tooth decay, and that this increased risk is also imparted by drinking beverages with high added sugars, in addition to quote-unquote eating too many added sugars, and that this is also consistent with the existing sodium warning statement and its language. So therefore, I recommend that DOHMH update the warning statement language to something like, quote unquote, consuming too many added sugars can increase risk of type 2 diabetes, weight gain, and tooth decay. And then, excuse me. Second, I propose that DOHMH should amend the proposed rule to require posting the warning statement in 3 locations within restaurants. And so local law 150 requires that the warning statement be posted in 3 locations. However, the proposed rule omits the requirement to post the warning statement on the menu or menu board explicitly, and also where a food or beverage item with high added sugars are sold as a self-service item dispensed directly to the consumer. And this is a problem because research strongly suggests that labels must be noticed to be effective, which is more feasible if the warning is displayed in all locations where customers make choices about potential purchases, including fountain soda dispensers. And then third, I propose that the DOHMH amend the proposed rule to enhance the warning icon, including adding text, changing the color, and modifying the design of the icon. So recent evidence suggests that warning icons accompanied by text compared to icon-only designs lead to greater reductions in target nutrients per order due to large increases in noticeability. This work also indicates that larger added sugar warning labels in the color red versus black, for example, and 150% size versus 100% size of the menu item text and positioned to the right of menu items versus the left are all more noticeable, based on the research. So I strongly recommend that DOHMH amend its proposed rule to mandate that the warning icon be accompanied by an explanatory statement in all 3 locations, such as quote-unquote added sugar warning. Philadelphia, for example, requires the sodium warning label icons plus text, so precedence exists for such an approach. And the proposed design is also a little visually ambiguous, so I suggest that DOHMH consider a design that clearly indicates that a product is high in added sugar, especially if warning text is absent, including designs developed and tested by researchers in other countries. So in sum, I propose several modifications to the proposed rule, including 1, amending the proposed warning statement language, 2, requiring posting the warning statement in 3 locations within restaurants, 3, adding the text added sugar warning to the icon, 4, modifying the label to be red, larger in size and positioned to the right of menu items, and then 5, designing the label to clearly indicate that a product is high in added sugar by using pre-existing options. So thank you again for the opportunity to provide testimony.
Thank you so much, Professor Rumo. I'll look out for your written comment as well. Thank you. Our third registered speaker is Tiffany Lee. Let me just see. Oh, yes. So, yes, we can hear you. If you'd like to introduce yourself and then give your comment, that'd be great. Thank you.
Thank you. Good morning. My name is Tiffany Lee, and I'm the Executive Director of Altagracia Faith and Justice Works, a nonprofit in Northern Manhattan dedicated to putting faith into action, promoting social justice within our local immigrant community. We organize social justice ministry teams, support a community fridge project, and offer a youth service learning program for high school students, which covers topics such as hunger and food justice. Following this youth program, our youth leaders have demonstrated a passion for food justice and have continued working with us on advocacy campaigns related to nutrition and food justice. We are proud to partner with the Interfaith Public Health Network and the Center for Science in the Public Interest to support these important campaigns that address disparities in our food system and the disproportionate targeting of low-income communities of color with predatory marketing and an inundation of fast food, ultra-processed food, and beverages with excessive added sugars. We have seen the disproportionate health impacts of diet-related diseases in our communities and the community's desire for fresh, healthy foods through the Community Fridge Project. Injustices within the food system must be corrected to allow community members to make informed decisions. One such injustice includes the lack of transparency about what people are consuming. Knowledge is power, and we applaud the Sweet Truth Act for requiring more warning labels to increase consumer knowledge and allow people to make informed decisions about their health. With that said, we support the following changes to the rule that could make it more effective. 1, modify the proposed warning statement language to, quote, high added sugars intake can increase risk of type 2 diabetes, weight gain, and tooth decay, end quote, in order to clarify that it is not only eating added sugars, but also drinking that contributes to type 2 diabetes and weight gain, and not only contributes, but actually increases the risk of type 2 diabetes, weight gain, and also to include tooth decay. 2, require the warning statement to appear in all 3 of the places that Local Law 150 designated, not only the point of sale, but also to include on the menu or menu board and where items are sold as self-serve and dispensed to the customer, like soda fountains. As someone who regularly communicates with community members and especially with teens, the more we repeat, highlight, and embolden the key phrases we intend to emphasize, the better chance it will catch people's attention. Having a warning statement in only one place can easily be missed or ignored, whereas having the warning appear in all three places will greatly increase the likelihood of being noticed. 3, include warning icons on the electronic menu items, including electronic menus in store, the restaurant's app, and via third-party apps like Grubhub, Uber Eats, etc. This relates to the last point in that all warning labels should appear in all places of sale, including frequently used third-party apps, so it will not be missed or ignored. 4, require added sugar warnings that have icon and text to make them more noticeable and more effective than icons alone. And 5, add warning text to the icon in the proposed explanatory warning statement. Thank you for your consideration and your efforts to make this law as clear and effective as possible.
Thank you so much. That was our last registered speaker. If there's anyone in attendance that would like to speak, if they could just put their name and their title into the chat and I can ask for them to be unmuted. I'll give it a minute because I don't think I saw anyone. Oh, great. I see we have Lewis King, KCS, would like to speak if they could be unmuted. Great. You're unmuted, Mr. King, if you'd like to give your comment.
Hello, good morning. Can you hear me?
Yes, we can. Thank
Great,
you.
thank you. Thank you for the opportunity. Hello, I'm Lewis King. I'm the Assistant Director of the Public Health and Research Department at Korean Community Services. We provide health and social services to vulnerable communities in Eastern Queens, but currently expanding into the Manhattan area. I'm really excited to be here and to be sharing our side of the story. We're a proud standing partner with IPHN, the Interfaith Public Health Network. And today we are urging the New York City Department of Health to amend the proposed Sweet Truth Act by requiring the warning statement to appear in all three of the places that Local Law 150 designated. This includes not only at the point of sale, but also on menus and where items are self-served to customers, such as public soda fountains. Currently, these warning labels are only required to appear at the point of the sale. However, for these labels to be more effective, they must be visible to consumers at multiple locations. Fast food chains in New York City disproportionately target vulnerable neighborhoods with foods and drinks beyond a daily limit of 50 grams of added sugar, making it challenging for individuals to maintain a healthy diet. Excessive consumption of added sugars increase chronic disease risks and is associated with excess body weight in children as well as adults. In New York City, diabetes rates are increasing at an alarming rate, especially with the Asian American and Pacific Islander population at high risk. Diabetes is the 5th leading cause of death for Asian Americans, and 48.5% of Asian American adults living in New York City have either diabetes or prediabetes. The reality is that one New York City resident dies every 90 minutes from diabetes-related causes. Here at KCS, we are actively engaging in addressing these concerns, these issues on a daily basis, offering weekly type 2 diabetes education and prevention classes to our Korean community members. A recent Center for Science in the Public Interest poll found that 85% of New York City residents support added sugar warnings on chain restaurant menus, highlighting the need for transparency in our food choices. New Yorkers can counteract misleading marketing tactics by requiring sugar warning labels to all 3 of the places that Local Law 150 designated. Thank you for the opportunity, everyone.
Thank you so much, Mr. King. If anyone else would like to speak, they can also, the same as Mr. King, put your name and your title into the chat and we can unmute you. You can also raise your hand, the symbol, if you would like to also be comment, that's also okay. Just as a reminder, all written comments must be received by 5 p.m. today. The email to send it to is also in the notice of intention, but for reference, it's resolution comments with an S at health.newyorkcity.gov. You can also submit it online on the rules website. It's http://rules.cityofnewyork.us. And you just search for our rule. Okay. I don't see anyone else joining or raising their hand or putting their name in the chat to speak. It is currently 10:30. We are going to adjourn until 11:30. We'll adjourn till 11:30. If you would like to speak in the meantime, if you just put your name in the chat, it'll be monitored and we'll come back on the record for you to be able to give your comment. All right, we're going to adjourn until 11:30. Thank you so much. Thank you. It's 11:30. If we could start recording again. I apologize. I think if everyone, can you hear me? Okay, great. Sorry about that. It is 11:31. If you are joining the hearing now or have joined during the adjourned period and you would like to testify, please indicate so in the chat area by writing your name. The purpose of today's hearing is to elicit comments and information to assist the commissioner in determining whether to add a new Chapter 39, the added sugar warning, to Title 24 of the Rules of the City of New York. The rule requires food service establishments to warn consumers about menu items containing high amounts of added sugar. I'll give a minute to wait to see if anyone puts name in chat or raises your hand. Okay, I don't see anyone putting their name in the chat wishing to speak. So we're going to adjourn until 11:58. The public hearing ends at 12, so we'll just check in at 11:58 to see if anyone has put their name or would like to speak right in the last minutes. So let's adjourn the hearing to 11:58. Thank you so much. It is now 11:59. I do not see any other names or anyone that has raised their hand or emailed asking to speak. If you would like to speak, though, please put your name now. I'll give it a minute. Okay, I do not see anyone else that wanted to comment. So it's now 12 o'clock. There being no persons joining online or calling us who wish to speak, this hearing is now concluded. Again, please submit any written comments by 5 p.m. today to resolutioncomments@health.nyc.gov or submit them online on the rules website. Information can also be found on the notice of intention, how to submit a comment today by 5 p.m. Thank you so much.